This 53rd session of the United Nations Commission on the Status of Women is putting the issue of the sharing of roles between men and women in care work firmly on the global agenda.
One great thing about these forums is they are one big spotlight. 180 countries, gender ministers from all over the world, they come together and there's one big glare that is put on them. And everyone goes out there and trots out information on what they're doing, but it's also a great time to say what they're not doing. So we intend to put our governments under the spotlight at the CSW and to use the pressure of these international forums to say these are commitments not just in our region, but these are global commitments. This is a global issue.
And in the field, GEMSA continues its work lobbying and campaigning for better recognition and support for the crucial role these ordinary men and women are playing in the Southern African region.
And so through that advocacy, through that networking, information sharing, organizations have been able to make governments realize that this is totally unfair and actually a violation of rights of both women and girls.
Dizem que nós não temos direito e eles estão a violar os nossos direitos e gostaria de saber também para o governo.
And in that regard, they have put in systems in place to train those women, to have them understand what it is to care for a person who has AIDS. So, having said that, that doesn't mean, however, that the whole concept of the division of labor in our societies in Southern Africa has been transformed. Because wherever you go, work is still done by women, and when men come into the fray, men are paid for that work, whereas women volunteer.
Para ajudar os cuidadores, eu gostaria que talvez eles aceitassem que os que fazem os cuidados terem salário, apenas ter salário mínimo, porque assim só estamos a trabalhar de.
A look at Swaziland highlights the plight of care workers who, though overwhelmed by the relentless numbers of people infected and affected by the HIV and AIDS pandemic, continue their work, making visits to their clients' homes daily.
Care workers in the communities, they are not paid for them, and yet they are the ones who are doing who are taking care of the sick at home. And you would find that a care worker is taking care of 20 people who are sick. So going from each homestead in the communities, they have to go, there's no transport and there are no clinics. In most cases, you find that it's a woman or a girl child. Some of the children, especially the girls, they drop out of school because they will find that both parents are dead and she has to take care of the siblings at home.
The iStories is a collection of books and online resources produced by GEMSA that contain moving human stories told by persons in Southern Africa communities.
What we are doing with this care work project is trying to put faces on these figures and go beyond these figures and see that it's not a question of statistics. There's more to it than statistics. And you know, when you put faces on statistics, then you have the real, you can see, you give life to all these problems.
One set of these stories, generated by the GEMSA project, tells the remarkable story of how 3 generations of women, inspired by Mama Rose Tomei, got involved in the fight against HIV and AIDS. In 1996, Mama Rose started Let Us Grow, a community-based volunteer project. Today, Let Us Grow, with a volunteer staff of 60, provides support and care for over 2,000 people who are infected and are affected by HIV and AIDS.
I'm happy because you are here been complaining about the place that I'm operating. It's like a pigsty. It's not healthy for people.
So here's a beautiful example, actually, of how a government initiative and a community initiative are working together to bring care to a community. But even then, the people like Mum Rose, they work out of a container. They don't even have an office to work from. The mayor of Johannesburg, when he went there, was shocked and contributed the container that she works out of. That's not good enough.
You can't move around the Let Us Grow project for more than a few minutes without bumping into the many orphans and vulnerable children that the project gives a special place in its heart to. One of their care workers, Johnny Majake, makes daily visits to orphaned children, heading up households and looking after their younger siblings in Orange Farm.
We normally give the children a meal each and every day for those who don't have any meal. And the ones who are taking the treatment, we are giving them seizure for early in the morning before they can take the treatment. They can just eat seizure, which is a soft porridge mixed with water.
A crucial and often overlooked need of orphans and vulnerable children is to just be children. Physical play and mental stimulation are vital for childhood growth and development.
As you can see, now we are doing boost dance, but we don't have the boots to do the boost dance. And sometimes we do sports, but we don't have the balls and the playground, so it's not safe to play sports around here. Yeah. And then the flip charts and the marking pens we don't have. And our container is ruined, so we can't get too many people in here. We have to divide them.
Away from the hustle and the bustle of the children, the home-based carers team visit those who are most sick. Agnes is a care worker, and she recently had a young woman die in her arms.
Today I just think about that person, and I blame myself. Maybe somewhere, somehow, something wrong I've done.
If you look at it long term, the situation does not look like it can sustain itself any longer. That we have not stabilized our new infection rates. It therefore means that the burden is increasing. And while the burden is increasing, the resource for caring is decreasing. Because the women themselves, the carers themselves, if once again I would refer to the cause in terms of their mental health and their vulnerability, they themselves are also in the statistics of the number of people that are becoming infected. And you ask yourself, who then is going to be caring for who?
Today, after 12 years of commitment to the people of her community, Mama Rose continues to make a difference in Orange Farm. Perhaps this is why, in 2008, she was asked to help to set up a similar home-based care and support project in Lesotho.
We can see beautiful houses around here, but inside the beautiful houses there's no resources and there's nobody. People are working from the mines, they are bringing money, but they don't know what is happening inside the house. Their kids are ill, their wives are sick. They are staying there, they don't know, nobody's here for them.
So are some countries getting it right?
There are examples of countries in our region that have been very progressive. Botswana is a case in point.
Botswana is a small nation that is coping with one of the highest HIV positive rates in the world. Unlike many other governments in the Southern African region, decision makers here decided some time ago to face the storm head on.